Hi, welcome back to Pills and Bills. I'm a practicing clinical pharmacist with a passion for teaching and an even bigger passion for paying off my crippling student debt. I did design this top 200 drugs book myself to help med, nursing, pharmacy students, and techs learn smarter. So grab a pencil, let's color, review, and make these drugs stick together. If you'd like to color along with me, this book is available on Amazon and TikTok Shop. Just search Top 200 Drugs Simplified. If you find this helpful and you want to support this series, tap like, share, or drop a comment. Every bit helps. And with that, let's begin. Up next, we're going to hop right into Furosemide, brand name Lasix. It is a loop diuretic. I'm going to color the brand name Lasix in blue and green. Blue is to remember that this med helps you let go of water. Green, kind of for that relief feeling. This medication could provide a lot of relief to patients, specifically with signs of volume overload like swelling and shortness of breath. Now, the first trick is that the brand name Lasix has a little built-in memory aid itself. It's said to come from last 6 because the diuretic effect typically wears off about 6 hours after you take it. So super easy way to help remember both the duration as well as the brand name. One pretty cool thing you might not know about Lasix is that it's actually also a venodilator. So what that really means is that before the diuresis effect even begins, Lasix can start to widen the veins and reduce preload, which helps shift fluid away from places like the lungs where it shouldn't be. This is why patients often feel better before they even notice any urine output. As we mentioned, Lasix is commonly used to remove excess fluid in disease states like heart failure, hypertension, and patients with pulmonary edema. While hypertension is technically a labeled indication, it isn't very effective as one. Its action is very short, as we mentioned. It only lasts about 6 hours, and once the effect wears off, the body really compensates by retaining sodium water, which is the opposite of what we want for sustained blood pressure control. To remember these indications, you can think of Lasix like a drain, and with the mnemonic listed below, you can remember the effects of Lasix as a diuretic. Flipping to administration of Lasix, it can be given both orally and intravenously. Makes it useful for both when you're outpatient as well as in the acute care setting. I'll be color coding oral drugs in green and IV drugs in red to help me remember. Consider doing the same as you color along. Okay, dizziness, why does it happen? Lasix lowers your blood pressure and reduces your fluid volume relatively quickly, so sometimes your body doesn't always adjust fast enough, especially when you're standing up quickly. It can contribute to that lightheaded, dizzy feeling. And our most commonly seen side effect, electrolyte imbalances. This can be low blood potassium, sodium, or magnesium. These imbalances occur because Lasix blocks sodium resorption in the loop of Henle, and unfortunately potassium and magnesium get pulled out with it. We have to continue to monitor these closely, as these shifts can lead to something as little as muscle cramps or weakness, or something as serious as arrhythmias. Flipping to our warnings, interestingly,